The next topic for discussion is abuse. I would like to remind you as we start to talk about it that there's also a section on child abuse in the pediatric section, so you might want to take a note of that as well. And let's start out by talking about a question. A woman is brought to the emergency room by her husband who will not leave her side. She has a spiral fracture of the humerus, a fractured nose, numerous lacerations in ecchymotic areas, and 2 teeth have been knocked out. The patient says, "I fell." What should be included in the nurse's care? 1, tell the husband a urine specimen is needed and take the woman to the bathroom so you can talk in private. 2, ask the husband if he beat his wife. 3, encourage the client not to return home with her husband. 4, immediately report to Adult Protective Services. Now, the answer to this question is number 1. The data in the question support the idea that this woman might have been abused. We know that spiral fractures suggest twisting types of motion. She has a broken nose, which could happen from a fall. It could also happen from a beating. Lacerations, ecchymotic areas, and 2 teeth have been knocked out. So we don't have proof at this point that she's been abused, but it certainly is suspicious for that. And the fact that her husband will not leave her side. If we suspect abuse and you're not able to ask the patient because the husband is right there by her side, you might say you need a urine specimen, and this is probably the only place that he's not going to go with her. Most people would not accompany their wives into the bathroom for a urine specimen. And at this opportunity, you might say, sometimes when people have injuries like yours, they have been abused. I wonder if that's the case for you. And give her a chance then to tell you about it. She might or might not tell you. She is probably extremely frightened. Oftentimes, men who beat their wives will say things like, "If you tell who did this to you, I'll kill you." And the woman has been beaten up. She knows the man is violent and capable of abuse. In fact, many times they do kill them if they tell what happened. So it's a very real kind of fear. Now, if you approach the woman as I just described, she may or may not admit at this time that this is what happened to her. But at least you have given her that piece of information. You might also ask her if she would like referrals, if she would like the name of a safe house where she could go or she could take her children to if situations became difficult at home. Sometimes these women are candidates for a system that a lot of police departments have used with recycling old cell phones, where they are programmed so that they can only dial 911. And sometimes we give these to the patients so that they can call 911 if an emergency situation arrives. You probably are not going to just simply ask the man, "Did you beat up your wife?" This is, first off, he's probably not going to tell you. And secondly, this is likely to trigger further violence when the patient goes home. You cannot simply tell the woman not to go home with her husband, even if you're pretty sure this person may have abused her. This is an adult. And you can make them aware of the options. You can make them aware that this is not normal behavior. But because they are adults, you cannot take them out of the situation the way we might be able to take a child out of an abusive home. You can't do that with an adult. Now, we want to think about some of the characteristics of the abuser in abuse situations. Frequently, the abuser has a poor self-esteem, and he or she gains power by dominance over others. Substance abuse is frequently, but not always, an issue. Oftentimes, the abuser was abused as a child. As we say, the abused grow up to abuse. That's the pattern they learned. One would think, perhaps, that they certainly would not want to repeat that pattern. However, What we often see is that's learned behavior, and that's the only behavior they learn, so that's the only pattern they know as far as relationships are concerned. They are often impulsive, immature, and very possessive in terms of their relationships. Now, the person who's abused frequently has a poor self-esteem. Now, when we say they accept responsibility for others, we're talking about situations like this. For instance, a woman has been brought into the emergency room, severely beaten and abused. And maybe the woman admits it to you and says, well, yeah, you know, he roughed me up a little bit, but it was really all my fault. I know he likes to have dinner promptly at 6 o'clock, and we didn't sit down to eat until 6:05. Now, if I had had dinner ready exactly at the time that he wanted that, this never would have happened, so of course it's my fault. Or maybe she says something like, my husband likes the house peaceful and quiet when he comes home, and the children were squabbling, they were arguing with each other, and that's what triggered him off. If I had done my job as a wife and had the children behaving properly, then you see this would not have happened. So therefore, it's really all my fault. This argument makes no sense to most of us. But this is the type of thinking that people who have been abused may be having. So they're accepting responsibility for others. It's all my fault somehow. Oftentimes, patients who have been abused are scared. They may also be guilt-ridden. It's my fault. Somehow, this is all my fault. I'm not a good wife. I'm not a good person. This type of thing. If I were a better person, this type of thing wouldn't happen. We know that's not rational kind of thought, but that's what often will happen with these patients. It may take many episodes and even many months before the woman, or years even, before the woman decides this is enough. Because after the man abuses her, and usually, I shouldn't say man, but usually it's the man that beats the wife. Sometimes it's the other way around. But after the abusive incident, the abuser will then feel guilty and remorseful. And then comes the flowers and the chocolates and the promise never to do it again. And things go on smoothly a little bit until the next thing that sets him off, whatever it is, a bad day at work, bad weather, whatever. And the whole cycle starts again. The anger spirals, the violent outbursts, then the remorse, the guilt, the apologies, and it goes on over and over again. At some point, the woman may decide to leave and often take her children, because if he beats her, he's likely to be beating the children as well. You cannot force an adult woman to leave. You cannot even, say, if I were you, I would, because this is not good nursing care. But you can let them know it's not normal behavior, and there are alternatives, there are resources for the patient. An elderly woman is admitted with a subdural hematoma. There are numerous ecchymotic areas and cigarette burns. Elder abuse is suspected. The nurse aide says, every time I see her family, I get so angry. How can anyone hurt such a sweet lady? Which initial response by the nurse would be most helpful to the aide? 1, it is not appropriate for nursing personnel to make judgments about people. 2, it is very upsetting, isn't it? 3, there is no proof yet as to who abused her. Or 4, you should try to understand how frustrating it is to care for the elderly 24 hours a day. Now notice the question. It asks us, initial response most helpful to the aide. Now as you are selecting your answer, I want you to remember that the same therapeutic communication techniques we use for patients should be used for other personnel. So the best answer is number 2. Recognize the client's feelings. It is very upsetting, isn't it? After you have said that, diffuse the anger a bit, then you might talk about making judgments and some of the other answer choices. I also want us to take a little look at rape. Now, when it says on here, myths, this means that these are things that people say that aren't true. It is not true that you can't be raped unless you really want to be, or that the reason that the person got raped is that their dress was cut too low, the hem was too high. It is not true that in order to be raped you must be promiscuous. It is not true that you can't be raped against your will. You can be. Usually the rapist is much stronger and more powerful than the victim. It is not true that rape is simply an impulsive act, or that it's an act that just can't overcome because you are so ravishingly beautiful. Usually rape is an act of anger against women. It's not based upon just how beautiful the person they're with may be. It is not true that women frequently get revenge by accusing men of rape. Most women would never go through that process. So those are some of the things that people say about rape that are just simply not true. Now, if you have a patient who comes to the emergency room and says they've been raped, some of the things you need to do: provide privacy. I would make sure that they were cared for by a female nurse if at all possible. They are probably not very comfortable with men at this point if they've just been raped. Now, if you ask a patient what they want, the thing they're going to say is they want most is to bathe. But we can't let them bathe immediately because we need to gather evidence. So this means that they'll do vaginal aspirations to get secretions. If identified, we could conclusively prove that this was the rapist. So if the victim says, this man is the one that raped me, and we have the secretions, we can use those for DNA evidence to match that. In addition, we might need to comb the pubic hair. Hair can be used to identify the perpetrator of the crime. Once any evidence has been gathered, and then any suturing or care for wounds has been done, then we might allow the patient to bathe. One patient I know who was raped told me, and I have every reason to believe her, that she was in the shower for 24 hours following her discharge from the emergency room. She felt, quote, so dirty that she just needed to bathe and bathe and bathe. Now, this young woman had problems for many years afterwards. And that's very common. They go through a post-traumatic stress disorder type reaction. Make sure that before the victim leaves the emergency facility, there is someone to accompany them. If necessary, make referral to the Rape Crisis Center and a rape crisis counselor. Perhaps they have family members who may accompany them. Now, remember also that sometimes family members have big issues with the rape because they're always, did you enjoy it? What was it like? So they may have some issues and may not be as supportive as one would hope of the victim. But make sure that they have referrals for follow-up, because the trauma is really just beginning. The physical trauma of the rape is bad enough, but the trauma that continues afterwards is devastating to many patients. And by the way, most victims know their assailant. And most women fear walking down the street and being attacked by a mad rapist out of the blue. But that's not usually what happens. Usually it's someone that they know and perhaps had even trusted that violates that trust and rapes the patient.